You're listening to a podcast from Dublin's Talking. Downloaded from sunshineradio.ie.
Westport is set to become the Botox capital of the world. The US pharmaceutical giant Allergan, I think it is, which manufactures the anti-wrinkle drug, yesterday confirmed a massive 274 million expansion in the County Mayo town, which is going to create over 200 jobs there over the next 4 years, which is great news for them. But when we speak of Botox, it brings us back to another story that was in the paper today. RTE star and pop beauty Sharon Corr was urged to have Botox treatment. A cosmetic specialist made the comment about Sharon, a judge for the new RTE singing show The Voice of Ireland. She said, gosh, Sharon Corr looks in great shape body-wise, but she's lost volume in her face. Dr. Patrick Treacy from the Ailesbury Clinic joins me on the line. Patrick, good evening. How are you?
I'm fine, Lynsey, thanks.
Good to talk to you. Now, not only, I've spoken to people about this today. A lot of people speaking about Sharon Corr. Personally, I don't think she needs it because I think she looks really well, and she was in studio with me here a couple of months ago and she looked absolutely stunning. I didn't even realise she was 41.
I know, I was chatting only a few days ago in the Merrion Centre at the little coffee thing, and certainly she looks fine to me as well. Yeah. I would possibly see this, with the greatest respect, as a potential marketing ploy or whatever, but certainly Sharon looks lovely. And it's funny, I just posted on my Facebook the page about 2 hours ago that particular article saying, for God's sake, Sharon is lovely, would you leave her alone?
Yeah. Now, Botox, what else is the other thing that I was speaking about earlier on, is that Botox, from a medicinal point of view, it's an incredible thing. I mean, we spoke about this a long time ago, Patrick, about Botox and migraines and the way it can help incontinence and things like that.
Sure.
I mean, that's where it originated for, I believe.
Well, certainly, I suppose it originated in a non-cosmetic vogue, from the point of view that we certainly used it originally for the treatment of strabismus, which is patients who've got eyes that are bent to one side, and later it moved into blepharospasm, is where patients have a tick in their eye which causes it to flick all the time. And the interesting thing is that Jane Carruthers, who I suppose came up with this in 1992, had a patient who came into her, and she told me this story herself, that whenever she had injected for blepharospasm, the patient came in and said, look, you forgot to inject me here, my wrinkles are still here. She said, but I wouldn't be injecting you, that's your forehead, you've got sort of injections around your eye for blepharospasm. And her husband, Alistair, picked up on this, and injected, I think it was Catherine Jenkins, their secretary, and once they realised what was there, in Alistair's own words, the genie was out of the bottle. But there's no doubt about it. I mean, it is the penicillin of the 21st century. It is used as widespread, as you quite rightly said, recently, therapeutically approved for Botox for migraines, but right across the board. I mean, there's no doubt about it. It can be used for incontinence. Believe it or not, it can even be used to shrink prostate cancers.
Wow.
It can be used for, obviously, pain control mechanism, and we could see Botox technically as a postman, and what it's doing is specifically going and linking into these specific receptors that are on muscles called acetylcholine receptors. And if you can imagine, if we could attach some other things onto that, we could really have the genie out of the bottle. We know, for instance, the sea anemone off the coast of Israel that you can attach onto. It has pain-killing anesthetic effect. This can be hijacked or onto the back of the Botox molecule, and when you inject it, it goes just like a postman to a particular receptor and can be used as a nerve blocker. So, the potential for Botox is only as wider as our imagination is.
Indeed. We've a question here for you. What would be the effect of getting Botox injected into your legs if you had mobility problems? Would it make you more or less mobile?
Sure. I suppose Botox will always be used in conditions where you have spasm to release the spasm. So if a patient, we'll say, has had a stroke and as a consequence of what we call an upper motor neuron lesion, and they've got spastic limbs, if you inject them, then they can function with those limbs again. If we have a child born with cerebral palsy, and you know that most children born with cerebral palsy are of normal IQ, but they're legs are so spastic and the limbs are so spastic they can't move. Now, when I did paediatric orthopedics in Crumlin back in 1988 with Ozzy Fogarty, and I was on that team, we had to do limb lengthening procedures. In other words, we had to extend the length of the Achilles tendon. We had to do sort of metatarsal, orthopedic things that in this day and age you don't have to do at all. Young children can just be injected with Botox, and for 4 to 6 months they'll be able to ambulate, sort of quite normally in most cases, and in ways that sort of, years before, we could only provide surgical options. And obviously surgical options have a role, but the internal problem of the nerve and its tone and the spasm still exists. So as the child gets older, obviously the limb will grow at a different rate than the tendon, and as a consequence they may need sort of repair things. So you've got or review repair operations, but you've got a situation here where, particularly with cerebral palsy and many other spastic conditions, we have got I suppose a wonderful therapeutic drug that has now been in the marketplace for certainly 30 years, believe it or not, since 1992, and there isn't any evidence that we've come across of any long-term problems with Botox. You may get some short-term side effects that wear off as soon as the Botox wears off, and believe it or not, the Botox often doesn't wear off. What we have is new nerves growing around it, so the body has this almost inbuilt mechanism that all side effects become depleted just by nature.
It's amazing. I mean, it really is the wonder drug it really is, does seem to be the wonder drug.
Absolutely. And it's interesting that I heard you saying that Allergan have opened up again a bigger facility for Botox. And of course, we also use Dysport, when there are a couple of different variants. Ireland also had Botox B, which unfortunately only lasted 3 months. And
what was Botox B?
Well, most of the Botox we use is Botox A. It's neurotoxin A, and that would be Dysport, Emerville, Bocatur, Botox, Azalure. Botox B was made in Athlone by, do you remember that company that unfortunately got caught with that schizophrenia drug as well, or the Alzheimer's drug?
I do. I can't.
And it was a wonderful company from the point of view that some really innovative products, and they were once the biggest listing, almost bigger than the banks, Elan Pharmaceuticals, wasn't it?
That's right.
And they unfortunately came up with a wonderful. There are 7 to 9 different types of Botox, the same as there is hepatitis, with different subseries, and some of them can be used in humans, some of them can be used in animals, and 3 of them can be used in humans. But they came up with Botox B. But unfortunately, it's only used in Canada now. It couldn't really compete in the marketplace because if it only lasts 3 months and the rest of them last 4 to 6 months, then, it's a non-starter. We use it from time to time in people that develop non-responses in Botox A. But outside that, we would hardly ever use it.
Right, okay. So that wouldn't be used cosmetically?
It wouldn't. Well, the patients start complaining very soon. Sorry, Dr. Treacy, your Botox only lasts 3 months. I can go up the road and it lasts 6.
Yeah. So obviously you're going to use what lasts the longest. I
Sure.
mean, we know that it eliminates, I suppose, the crow's feet and the wrinkles in men and women who are aging. And a lot of people, I wouldn't have an issue with using Botox at all. I think it's an amazing drug, and I suppose it. When you see that this is available now for medical card patients who are suffering from certain medical conditions that can be treated with Botox, I think it's brilliant and very innovative.
Well, certainly, I suppose the big one there is hyperhidrosis and sweating, and absolutely changes somebody's life to a large extent. I know a lot of patients. I mean, I treated a patient today whose Botox had worn off on their hands for sweating, but they were afraid to go into work this week just because their hands were too sort of sweaty and slimy. They didn't want to sort of, meet people.
Yeah.
And certainly we see that as well with... I treated a very young child the other day, actually, for hyperhidrosis for sweating underneath the arms. The child was only 11. I'm sure that there aren't too many worldwide of that age, but the mother had the same condition. She came in, she's medical herself, and as a consequence, It was very, very successful. Something that's working, sort of very locally, and the therapeutic benefits of Botox for sweating can often last 10 to 11 months and kick in the day afterwards.
I've heard stories about people sweating and the problems they've had with it, and heard, with the Botox, that the incredible change it can actually bring to someone's life. And
Lynsey, if we have time, I could relate a very interesting story that day, or that way. Back to 1997, even before Botox was widely used for sweating, 1999 was the first papers I've seen. When I was down in Toowoomba in Australia, I had a woman who had bust a red light on her way to a laundrette, and she used to have these impulsive sort of almost rages where she had to go and get her wedding dress laundered because she had such bad sweating problems that all her photographs were destroyed, and it created a psychological problem in her mind, and as a consequence she had to get this wedding dress even though it was clean, re-cleaned every few months, and she was racing to the laundrette before it closed and the police pulled her over. And she was the first patient ever I used Botox for sweating, and not only did it solve her sweating problem, but it solved her psychological problem, which was amazing as well.
That was incredible. Absolutely incredible. Great story. Listen, Patrick, great to talk to you as ever, and look forward to the book.
Oh, yeah, I just finished it the weekend. Now the big edit's on and looking for the agents, yeah.
Yeah, you just need to get it all sorted out now and get it out there. And
that's what reminded me of that story. It's in there among some of the other good ones on Australia.
Brilliant. Listen, great to talk to you, Patrick. Thanks a million for joining us. Take care. Dr. Patrick Treacy, plastic surgeon and founder of the Ailesbury Clinic.